Hey, Susan, thanks for talking to us about your experience with the implantation of the ReActiv8 multifidus muscle functional neurostimulator. You've had the procedure pretty recently, Susan. How long ago did you have it in, roughly?
2 months, 28th of April.
2 months. And you're happy to share your story with some of our patients?
Yes, definitely.
That might benefit from the same procedure. Tell us a little bit about why you decided to have the procedure in the first place and what symptoms you had in regard to your back.
I'd got much more back pain. I was walking bent over constantly. The family was saying, stand up straight, stand up straight. And I was trying hard, very difficult to go walking, being tired all the time from basically backache. I would think.
You mentioned you used to like going for walks on the beach and say, for example, doing that or doing the shopping or doing some housework. And sleeping, I think you mentioned, was a problem.
Yeah, very erratic sleeping, up and down all night, you know, being uncomfortable, backache, etc. Yeah, and since the procedure in April with the ReActiv8 going in as well, there's quite a difference, as my husband and family would tell you also. My husband's interrupting. He said, "You're sleeping over 8 hours."
Yeah, that's great.
Which is amazing, because the maximum I used to sleep, or I was sleeping 2 months ago, was about 3 hours if I was lucky in a block. Now I'm sleeping through. Yeah. And it's very easy. It's very easy to use the ReActiv8 system.
Yeah. So you just describe how you use that in your daily lifestyle.
Okay. So it goes on twice a day. You can't do so. I was told them both together. So you split the day. So I wake up in the morning and immediately I just don't jump out of bed. I have it ready on the side table and I do my half hour. So it's an extra snoozing time, I guess.
Yeah.
And the same at night. I go to bed and use it again, and I just sleep through then.
Yep. And then you have a good night's sleep. And what's your level of understanding of the condition of your spine? Like, you know, you've seen a lot of the X-rays of your spine in the past.
It's a disgrace, actually. I wonder how I got to that stage. Spine. It's very, I have, I think I'm pronouncing it correctly, kyphoscoliosis, so it's quite a bit of a bend. Yes. I had 12 years ago, actually, 2004 and 2005, I'd had 2 surgeries on my spine, which were totally waste of time and money and effort, where they put some pins and screws in, but
and that didn't actually address your pain. You still suffered a lot.
No.
So you've got a lot of accelerated degeneration or arthritis and degeneritis, and of course that means inflammation in the spinal joints and the paraspinal soft tissues. And then I talked to you about addressing some of that pain through regaining some stability of the very special muscle called the multifidus, and I talked to you about what the ReActiv8 device can do for that, and also the surgery, like the associated very safe risk profile of the surgery. Tell us a little bit about what that was like. Was it something scary, or was it a hard thing to go through that surgery for ReActiv8?
No, well, I don't think so. Not on my line of thought. I'm 79 years of age.
You're 79.
Yes.
Yeah, and you're having this surgery, and you know.
Yes, and I thought, well, I guess it knocks off a few brain cells. Get a bit forgetful, right. But I think at 79 you get forgetful anyway. Yes, it was a day surgery. I did stay overnight, and we actually stayed in the hotel near the hospital the next day, just to be sure in case something happened. But nothing did. It was a bit of a holiday.
Easy as, yeah. I remember seeing you the next morning after surgery, and it almost looked like you hadn't even had surgery.
Yeah, I was up about.
Were you wandering around that afternoon after surgery, walking around?
Late afternoon, yes.
Yeah. Okay. So the actual surgical procedure, as I do say, is one of the safest surgeries that I do for people. And that makes it very refreshing, because most neurosurgery and spine surgery, you've got to tell people what all those high risks are, and that's not very pleasant telling people that. But it's really nice to be able to say to someone, look, this is something that we can do for you, and it has hardly any risks. Of course, we still run through what those risks are, but it's really a very, very safe procedure. And now tell us about what sort of activity you're getting up to now that it's only 2 months down the track since the surgery. You mentioned your family's commented and you're feeling certain things.
Well, all the family, and I have two critical daughters. Oh, Mum, you're standing up much better. You're standing straight. You're not bending over. I'm quicker. I'm got so much more energy because I'm not in pain, and I'm walking a lot, as much as possible. But I'm on my feet all day. I just don't.
Busy body. That's great.
I've got 2 very young grandchildren, and both boys. They keep you hopping because I do a lot of minding.
Okay, well that's a wonderful little story, Susan. Thank you for that. I'll maybe just show you X-rays too. To them, I won't have your name on it, of course, but it just show you what your X-rays look like. And thanks for sharing your story. Appreciate that.
You're welcome.